Good morning. It's me, Nurse Hardy, your fearless healthcare liaison. I am aware that I have pink hair. This is the elephant in the room, the pink elephant, as it were. I tried to tone my hair. It was supposed to be rose gold, and it became very, very pink. We're going to be fixing it this weekend. If this color is offensive to you anyway, please feel free to imagine it in the most pleasing color of your choosing. Today we're going to manage diabetes in the school setting. I know that we don't have any diabetics, but we have to really kind of know a little bit about what's going on. Some of you might be diabetic, some of your family members might be diabetic. So hypoglycemia is low blood sugar. So if you hear PO, it's low. It's usually less than or equal to your blood sugar reading of 80. Usually when people are hypoglycemic, they'll be shaky, jittery, sweaty, they'll be hungry, pale, headachy, sleepy, dizzy, blurred vision, all that great uncomfortable things that happen when we have low blood sugar. And then there's hyperglycemia, which hyper is high blood sugar, and hyperglycemia is blood glucose greater than or equal to a blood sugar of 300. Usually these people will be really thirsty, they'll have dry mouth, they'll use the restroom a lot more, and they will be nauseated, again, blurry vision and fatigue. It's really important that when we have a diabetic student in our midst that we are kind of keep half an eye on them at all times. Type 1 diabetes is insulin dependent or juvenile onset. This is where your pancreas doesn't make enough insulin. If the body has too little or no insulin, the glucose can't enter the cells. You see, your cells, they eat glucose, which is sugar. And it's like a lock and key method. You can't get into your classroom without the key. The key is insulin. So in order for food to get into the house, which is the cell, they need insulin. So if they're not making insulin, their cells will not get their food and will die. And it will cause severe, severe problems. Usually symptoms include fatigue, increased thirst, and frequent using of the restroom. Treatment is usually frequent monitoring and administration of insulin, diet, exercise, and rest. To treat hypoglycemia, it can occur really quick, so you have to treat it immediately, and they have the gel. First of all, call your nurse. They have the gel. They have a box of juice, non-fat milk, a can of sweetened soda, or 3 or 4 of those glucose tabs. And you need to remain with the student until they're able to safely, resume their activity. To prevent that, they need to eat. And I know that sounds weird, but they need to eat the right things. And their doctor will go over all that. And if you get a diabetic student, we will go over all that. Hyperglycemia is where they eat, but they eat the wrong things. Okay? It's slower, leading to medical emergency. And it occurs when they have too high of a blood sugar for too long of a time. You can prevent this by regular blood sugar checks, meals and snacks eaten regularly scheduled. Don't skip the snacks or the meals. Insulin taken on time, exercise assists, and in order to treat it, you need to administer insulin coverage if it's ordered by the physician, or suppress fluids, like get them to drink if they're able to swallow, because water will dilute. Okay. So type 2 is, they used to call it adult onset diabetes, but it can happen in children. It's where your body is resistant to insulin. It's not that you're not making it. Type 2 means you're resistant. Okay, and it's the decreased ability of insulin to move the sugar, the glucose, into the cell so the cell can eat. Risk factor is lifestyle choices such as diet, exercise, obesity, and a family history. You would treat this with frequent monitoring of your blood glucose. Sometimes they give them oral pills to treat this, and they don't have to take the needle shots. And sometimes they have to take insulin if it's that bad. If you have a hypoglycemic emergency, they will be unable to swallow, and they will not be able to follow directions. You turn them on their side. You stay with them until the nurse or the unlicensed diabetic assistant gets there. And if there's no school nurse or nobody else in the, you stay with the child and you find the first person you can find, get on the radio, tell them to call 911. You never leave them by themselves, okay? Treatment of emergent hypoglycemic is a glucagon injection, which is a very, very, very fast-acting sugar injection that you mix up, pull up in a needle, and give it to them. It can only be administered by a school nurse or a trained UDA. Students must be accompanied by a school nurse or UDA if participating in a field trip or extracurricular activity, which means if you have a diabetic and they're in band, or you have a diabetic and they're in robotics, or you have a diabetic and they're in anything that's any school, anything, there has to be a nurse or unlicensed diabetic assistant there. Hyperglycemia emergency is if the student becomes unconscious, it is immediately an emergency. They will be unable to swallow and unable to follow your directions. Again, turn them on their side. Remain with the student until the school nurse or trained unlicensed diabetic assistant or EMS arrives. If school nurse or trained unlicensed diabetic assistant is not available, call 911. In any emergent situation where they're unconscious, call 911 and do not leave them by themselves. School or trained UDA will follow physician orders regarding administration of insulin so that we can bring that sugar down and the person can kind of try to come out of it. And students, again, must be accompanied by a school nurse or a UDA or a parent if participating in a field trip or extracurricular plan. It's that easy. And that's it. That's all we need to know. That's Tier 1 and Tier 2 training. Tier 3 would happen if we actually had a diabetic student here, and then I would have to individually meet with everybody, and we would all have to go over the care plan and all that stuff. But for now, you've been trained. I'm going to leave a sign-in sheet in the workroom in the building Coach Skeen's office is in. And if you just want to sign your little name off, you did, because guess what? You just got trained and it was so super easy. I hope y'all have a great day and a great weekend and stay healthy and happy. Bye.